to show you how we go from a non-ventilator setup to setting it up for the ventilator. So one of the first things we need to do is take off our breathing bag. And we are going to attach our tubing that is now connecting from our breathing bag to the back of the ventilator here, because this is now acting as our breathing bag. I also want to make sure my exhaust is hooked to the back and then to either my F-air canister or whatever scavenging system I have. I need to close my pop-off valve near my breathing bag in order to maintain the pressure in the circuit. All right, so once I have my exhaust and my breathing bag set up, I need to make sure I set up my maximum working pressure on the side of my ventilator, in which case for dogs and cats, we want to have this set to a maximum of 20 centimeters per water. That is my safety net. That is very important to set before I even think about turning this on. Before I turn on my ventilator, I want to connect it to my patient. I'm using this breathing bag as my patient today. I can then turn on my oxygen flow in order to bring my bellows up to the top.
You guys are done. You can go ahead and...
Once I bring my bellows to the top, I can turn my oxygen back down to whatever maintenance flow rate I determine based on the animal's size. And then I can turn my ventilator on, again, making sure that I've set my maximum working pressure prior to turning it on. So at this point, I can turn on my ventilator. If my bellows does not come back up the top, that means I have a leak somewhere, or it hadn't been raised up to begin with. So if your bellows is losing pressure, you just need to check, make sure you don't have a leak somewhere. All right, it is now returning to the top. On the front here, I have a couple of different buttons. The one here on the left is my inspiratory flow. That affects the size of the breath that's delivered to the patient. In the middle, I have my breaths per minute. And on the right, I have my inspiratory time. So that's how long it takes to deliver that breath. I will adjust to these settings based on what I'm seeing on my end tidal CO2 on my patient. And that's it.